who are going to talk to us about their stories, about the need for health insurance reform, and about the tremendous work that's being done across the state to make this happen. So thank you all so much for being out here tonight. I look forward to celebrating with you this year.
This issue affects me on such a personal level. I have been a Milwaukee public school teacher for 11 years, and I feel incredibly fortunate to have had the opportunity to have amazing health care coverage in my adult life. But I know what it's like to grow up as a child with inadequate health care coverage. My twin sister, Kiona, and I grew up in a family that struggled financially. We were the working poor. My father, as a small business owner of Sherwood Coin Shop, struggled with paying for adequate health care for himself and his family. Finances were always a source of tension in my family, and people always argued about bills. When we got sick, we didn't go to the doctor. The anxiety around inadequate health care affected my sister very much at a very young age. At the age of 6, my sister suffered from severe earaches. For hours she would cry in pain, and instead of taking her to the doctor, my grandmother would pour home remedies down her ear canal. She used a turkey baster to pour mineral oil down her ear. Her earaches did not go away. They got worse, and she lost a small amount of hearing in her right ear due to her inadequate health care coverage. As you can imagine, growing up in this environment caused a lot of tension and anxiety. My sister and I always felt like a financial burden and never wanted to do anything to upset the family. We coped with this situation by keeping our health care issues a secret. My sister suffered in this situation the most. The anxiety affected her stomach. At the age of 14, she threw up quietly in the bathroom sink every morning. I remember hearing her one day gagging in the basement and noticing that she was throwing up blood. I'm sorry. I asked her to tell someone, and she said this was the only time and that she'd be fine. I argued with her, but she said, "What can they do if we tell them?" This question is one that every mother, father, and child without coverage ask themselves every day. What will I do if? What will I do if I get sick? What will I do if I lose my home? What will I do if I have to choose between feeding my family and filling my prescription? What will I do if I lose my job? What if I can't protect them? When my sister asked this question, what can they do? I didn't have an answer for her. The guilt and the shame of causing a financial burden on our family stopped me from telling her secret. I wanted to tell someone I didn't. I was so worried that my sister was really sick, my twin sister. I sensed that this wasn't the only time that it happened and hoped that if it got real bad, that she would give in and tell someone. I prayed that she would be okay. I felt helpless and scared. I was scared of losing my sister and scared that my family would not be able to afford to take care of her. I felt trapped. I felt what 47 million Americans feel every day. What 47 million Americans feel every day. But in this moment, I am so proud of America. And I'm so proud of my sister, a new community organizer for Milwaukee County. I want to share with you a wise gesture that someone that I met this summer, Patty Ashford, shared with me on her hospital bed. She said that America is standing and walking around with their fists clenched like this. Clenched like this. Do this with me.